So today I have two people joining me. One you'll probably be familiar with. He joins with me on a bunch of stuff on this channel related to mental health. He was my co-host for the Differently Wired show. He's shown up on a lot of the standalone mental health streams. He is John Tucker, PhD. John, do you want to just remind people very quickly what it is you do for a living?
Yeah, I'm an ADHD coach, so I help people get their lives organized if they have some sort of problem where they're with executive function, which could be caused by any number of things: concussion, ADHD, autism, fetal alcohol syndrome, and so on. There's many reasons why a person's brain, well, PTSD, of course, is a big one, but there's many reasons why a person's brain may not be behaving the way they want it to. And it creates all kinds of misconnections in the mind-body area. So what I try to do is work on strategies so people can get things done. I don't do psychology. I don't do therapy. I simply help them with a plan to get organized, to sort out relationships. Oh, you go out dancing and your wife gets mad. So what can you do so she doesn't get mad? Give up dancing or give up the wife? I don't know, whatever. So I just help people with achieving the goals that they want to achieve. Now, in some cases, with developmental PTSD or something, they don't know what their goals are. So it takes a while for us to dig around and locate what the vision they have for their life in the future. So it takes a while, but that's the kind of folk I work with.
Disproportionately, it seems like the goal that comes about for a lot of your clients is getting rid of the wife. But anyways, let's go over to Corbin. Let's go over to
Funny
Corbin.
about that.
Yeah. It doesn't say anything about you. Corbin is somebody who's joining us for the first time, and one of the main reasons why I'm bringing him in is because he has direct experience with the subject of not ADHD, PTSD, the other four-lettered abbreviation. Corbin, I'll sort of get into how I came into contact with you in a second, but do you want to just do what John did and sort of tell everybody what it is you do?
Yeah, absolutely. So right now I'm a full-time military. I am in the United States Armed Forces. I'm an infantryman in the Army. I've had a lot of exposure to PTSD, which kind of pushed me down my pathway of pursuing mental health and mental health education. And presently, right now, I do see clients as a licensed professional counselor, and I'm pursuing a doctorate in clinical psychology.
That's awesome, dude. Yeah, Corbin and I came into contact because he was a fan of my YouTube videos, and when I put up a Patreon page so that people could support me financially, Corbin was one of the ones who was generous enough to donate at the highest tier. And then one of the rewards that you get from supporting me on Patreon at the higher tiers is that you get to have these 15 to 30-minute calls with me where we just talk about whatever. And, we talk about anything like games, mental health, and, eventually we got into the subject of counseling, which is what he does and what I'm looking to try and do in the new year. And so I thought, hey, given your experiences and, being in the military, and I thought with the new year coming around, I want to do new stuff in regards to mental health. Why not join forces and try to do something on PTSD? So here we are. We're going to talk about that. Just to start off, I think it would help if we just sort of lay out a general, simple understanding of what PTSD is so that maybe people who are listening to this that might not know they have it could probably identify with it, and then we can go from there. Corbin, I'll start with you, and then I'll go over to John with the follow-up question in a second.
So PTSD refers to a post-traumatic stress disorder, and it's often a consequence of having a traumatic experience for an elongated period of time. Now, that being said, there's different types of PTSD. You have acute PTSD, and then you have PTSD general, which would be more on the severe term of things. So often you'll see it within military personnel because you're in a stressful environment for an elongated period of time. But that being said, it's not just exclusive to military personnel. You can be raised in an abusive home for an extended period of time, and you can have PTSD from that. A lot of the things that people will realize if they have PTSD is it's usually co-diagnosed with some form of anxiety as well as some type of trauma. With those associations, it can create a long-term effect of PTSD.
Excellent. Now, John, I know that PTSD isn't your main focus, but like you said, you deal with a whole bunch of different people with different neurodiverse situations and afflictions. I'm just wondering, I'm sure that Corbin has come across it a lot. Like you said, he's in the military, and we'll get to his specific experiences with it in a second. But I'm just wondering, like, out of all the clients that you've had, how often have you seen it come up? And without obviously going into personal details, like, can you give examples of how it's come about with them?
Well, for the most part, it's the second kind that Corbin mentioned, where it's long-term abusive homes or traumatic events. Gabor Mate, who wrote about addictions and trauma, maintains that ADHD comes out of trauma. So the line between, having a dramatic acute experience and PTSD and a child who was born in an abusive home is a funny kind of line, because it all seems to have a traumatic effect. Corbin, you may or may not agree, but it seems to me whatever the traumatic force is, it upsets your equilibrium, so that you're not behaving in the way you would like to behave. You're not responding in the way you'd like to behave. So with my clients who suffered trauma, there are physical effects of the trauma that impact and can exacerbate the psychological effects. Maybe they're not eating enough, or indeed, maybe they're eating too much. I have clients who just can't stop eating. And it seems to me that there's a whole variety of ways this shows up and a whole variety of ways to approach it. I don't know, but most of mine is developmental, early childhood trauma, kind of like Gabor Mate talks about mostly.
What Corbin, just going off of what John said there, what sort of physical effects, aside from like stuff like you said, can't stop eating, have you seen when you've encountered PTSD?
Yeah. So to piggyback on top of that, I think one of the biggest ones I see is understanding the physiological emotion of anxiety. Now, a lot of people, when they feel anxiety, everyone has a different way of explaining it. Heart palpitations, the physiological response of the vagus nerve, which is the one that gets like the pit of your stomach feeling, as well as getting flushed, getting shaky, shortness of breath. Those are all physiological responses that I typically see in people that have PTSD or anxiety. Those can also be accompanied with nightmares. Nightmares is huge for people who have PTSD, or rumination. Can the constant thought of worry. And the thing that's so interesting about PTSD or anxiety that stems from trauma is that you don't have to be thinking about something specific. There's things you can think about that make you afraid. Like, I have a phobia of X, it could be spiders, dogs, what have you. And you see one and you feel those feelings of anxiety. But as soon as the stimulus is gone, you're fine. Your body can calm down. You're shaking off the anxiety. But someone who has PTSD, sometimes the antecedents or the triggers that cause those behaviors aren't always detected. And they can often be, I just have a feeling of being incredibly terrified right now, and I can't put my finger on what it is. And that's the thing that makes it so difficult to diagnose as to what can we do to fix your environment so that you're not feeling this way. Well, people who have PTSD can be afraid of absolutely nothing. There can be nothing present that they can identify that they're afraid of, but their body could be unconsciously predicting something. The environment can be familiar, whether it be a smell, a taste, something you see, and it can actually engage these symptoms.
I would imagine it'd be especially difficult to try and narrow down whatever it was that caused that problem in the first place, because my understanding of PTSD is when a human being encounters something that they can't come to terms with, that their present state of being wasn't able to comprehend. It could be a really, like you said, trauma. It could be something that's so evil that they can't wrap their head around it. And so when you're going to therapy and or a psychologist or a psychiatrist, trying to sort of force yourself to confront a whole bunch of different situations just to try and narrow down that problem could just lead to, it's not the right term, I don't think, but re-traumatize, just to have to go through all that all over again, to constantly put yourself in that situation where you're at the most extreme edge of things, like you just said, where you're just feeling worried all the time. Corbin, I wanted to ask, and John, you can jump in on this if you want to. Have you encountered clients where you have tried to walk them through what it was that triggered that thing, and what has sort of been your success rates in trying to figure out what those problems are and get them to confront them and deal with them?
Yeah, so it's funny because often my clients, in my experience, I've had maybe one or two that have some childhood trauma that they actually didn't realize until it's so interesting when we formulate the question of how was your childhood. I always like to start there with clients that I might have picked up a few signs that there might be anxiety or trauma in their past. And they're like, oh yeah, I had a pretty good childhood. And you're like, oh, okay, well, let's ask a secondary question. Would you be okay with your children living your childhood? And it's so interesting that the answer is always no way, never. And if you wouldn't have your child live it, then it's like, okay, you didn't realize it, but you had a pretty traumatic childhood. And children, when we grow up as children, we don't necessarily realize that what we're going through is trauma, whether it be we think it's normal or whether we're conflicted about the love of our parents, our providers, but we're in an abusive environment. So that's been a very small portion of my clientele. But some of the other ones, like the military, they know what their trauma is, getting the potential fear of getting injured, shot, not seeing their family every day, or having, mortars go off every week. And so one thing I like to do as far as getting them acclimated to their environment, again, and understanding that, yes, you have these defense mechanisms that your body has permanently built up because you were in an environment where you had the risk of getting killed for almost a year. What I like to do is exposure therapy. Start really, really small, get in a nice room, close your eyes. We're going to walk through a scenario in your mind. And that's as least intrusive as possible, and then we might look at pictures while we talk about it. Then we might watch footage while we talk about it. And it's a very slow process. And you really have to be careful monitoring your client to make sure that you're not presenting too much at once, because like you had said, you can re-traumatize someone. If there's too much exposure too quick, it can be more damaging than it can beneficial. So it's a really slow, gradual process, but it can get to the point where if they're working through their emotions and their feelings whilst being stimulated by this external trauma, that's how they can learn to cope with it and then survive it. And that's what we like to say is the survivability. You survived your trauma. You don't have to deal with it forever. Eventually you can survive your trauma and you can grow from it.
Okay, I have a follow-up question that I have for that, but I just wanted to get John's input on this. See, I imagine you use a bunch of the same technique, exposure therapy, right, John? Oh,
no, I don't do therapy at all. If someone needs therapy, I would send them to a person who does therapy.
Right,
so,
right, okay.
I would come up against the situation and where they need to walk through EMDR or whatever therapy it is, I wouldn't do it. In fact, my work is from the present moment forward. I don't go back. Now, sometimes the client will want to vent and talk about something. If they need to do it, okay, I'll let them do it. But I don't work with that. That's not my area. It sounds weird. I mean, there are people in the field of psychology who think I'm a threat. I'm not, because I don't do psychology. I am really not. And I send people away all the time. But there's a couple of very interesting, nuanced things that Corbin said. The first one that is wonderful and terrifying is that you can have a traumatic event. You can live with the effect of that traumatic event. It affects you mentally, physiologically, and then you can be affected by ripples in a pond, as it were. The event is no longer there, but the trauma still is there. So it lives in your body. And that reminds me of Stephen Porges. I don't know if you guys heard of him, but he's developed polyvagal therapy based on the issue of the vagus nerve and how important that is. So his whole career has been around working with that concept. As I say, I don't do therapy, but I happened to go to a conference where he was one of the presenters, and I was very interested because it was based on understanding the vagus nerve and all the wonderful and terrible stuff that it delivers. So if the trauma is no longer present, and if a re-traumatizing similar event is no longer present, then you have to deal with the impact that it has on the person. Now, in the case of a specific violent event in your adult life, it's pretty easy to identify the piece. But if you go back a long way and the traumatic impact was built over, sexual abuse, psychological abuse, and so on, it's really difficult to pinpoint a thing. Like, will I expose this person to ugliness. Well, I don't know. It seems to me like you need, what should I say, a nuanced approach. But then what occurs to me is that no one is the same. No two people are the same. So in fact, when you're treating somebody, it seems to me, well, actually, I must say this. I was actually talking to a traumatized person today, and he said he'd gone to this therapist twice. I said, you only went twice? He said, yeah, I don't think he listened to me. Oh, well, obviously, if he wasn't listening to you, you guys couldn't get along. But it struck a chord in me, and that reminded me of what Corbin just said. And that is, you have to walk someone through it gently. But it seems that you have to fine-tune your approach for every person. You can't just put them through a PTSD mill. And I did have a client who was a survivor of a hospital that had an exposure therapy mill, and he was traumatized by the treatment process. Yeah. Because it was not personal. It was not personal, exactly. Right. It was just, here's what we all do. We all stand up and we do this now and go look at spiders and snakes or whatever. But of course, because it wasn't curated to work for him, without the listening, without that connection between the healer and the client or whatever, I think it actually is a problem. I think you have to really, really listen well.
I have a lot that I could say on that. Some of the worst experience I've ever had, I don't think it's too revealing to let people know that I've dealt with mental health issues myself. I've been put in the hospital for them. And the way they try to deal with it by sort of turning it into like a corporate churning thing where everybody's treated as the same just makes the problem even worse. Corbin, I was just wondering if you had anything to say in regards to that and sort of what your experiences have been like in trying to provide that personal approach to people.
Yeah. So no, I think you guys hit the nail on the head. I mean, it is. There is no one size fits all. There's no panacea in the mental health field, because everyone's experiences are different. The way we shape our world is completely different. The way we understand our trauma is completely different. And so, yeah, I mean, exposure therapy is not a one size fits all. That's probably my most used method that I found the greatest success with. However, in some of my other clients, one thing we like to do is we like to do a dream journal. We find that is where we get the best benefit. And this specific individual has nightmares consistently that wake him up, and then he's up. Like, he can't go back to sleep. And there was a point where he was operating on average 3 hours of sleep a day. And that was just because he could not get the physical desire to even go to sleep. He wasn't meeting his Maslowian base needs.
Yeah.
And what we started doing is he would keep a record of his dreams. And then we would sit and we would use psychoanalysis. We would we would evaluate what he believed his unconscious self was trying to tell him. And we would just use talk therapy. And we've seen, between me and this client, we've seen a great turnaround in about the last 2 months of not even be able to make it through a session without crying the entire time, to coming in, laughing, smiling. We evaluated different coping mechanisms throughout the day to help kind of deal with, hey, I'm feeling anxious, what can I do? As well as even simple things, like just simple things that he can control in his environment, like rearranging his home, because he had identified unconsciously, he'd identified triggers in his home that he's like, if I move this room around like this, I'm not getting that trigger when I walk in here to feel the trauma. Now it's actually a room I enjoy being in. So little things that he has actually come to the realization of that will help. And that's one of the largest things when counseling, is that it's not a good counselor will give the least amount of advice. It's the best counselors will ask the right questions and allow clients to walk themselves and to guide themselves through their own mental health, because the client is going to know exactly with the guide, they're going to know exactly what's wrong and what they need to fix. The counselor can only be so objective without bringing in their personal bias. I mean, yeah. And no matter what, the best counselors, best psychologists, best mental health practitioners in the world, they can bracket everything they have when they bring it into a session. But no matter what, we all have our own traumas. We all have our own issues that they bleed through. I mean, I'm sure you're familiar with transference and countertransference and things like that. So
that's a Jungian principle, the idea of sort of just letting the client guide themselves towards the things that'll help them out. Because if you're trying to put forward your own interpretations or try to get involved too much, it can really screw up the process, and then you won't be addressing the problem, whatever. Also, the second thing, in regards to the dream journal idea, that's actually a really good idea. It's something that I did in my youth because I was told that once you keep a dream journal, it makes it a lot easier for you to lucid dream. So to be in control of what's going on when you're in an unconscious state, when you are dreaming. And I suppose if you do that with a client that has PTSD or has any other underlying neuroses that reside in their unconscious mind, if you get them to record how those neuroses show up in dreams, so that way they can confront them while they are dreaming instead of just letting the nightmare wash over them and take complete control of them, they can properly confront it. The classical Jungian confrontation with the shadow. It's something that I never really considered, but I imagine that maybe that would be the more expedient way of trying to figure out what it is that is causing the PTSD sufferer the problem, instead of just going down a huge list of what the problem could be and just spending too much time on that. So aside from those methods, though, I have to ask, because again, I don't have any experience with PTSD. I don't think I ever had it. But I'm just wondering where medication comes into stuff like this. Are there circumstances where just non-medicinal intervention just can't help the person?
I've probably diagnosed one person to go see their primary provider, I diagnosed the individual with anxiety. And the only reason at this point that I felt as though medicine would be a big benefit is if the client is unable to meet the bare minimum daily activities of living. And obviously with other severe mental illnesses, like, things like schizophrenia, dissociative identity disorder, things to manage like psychopathy, you're only going to be so effective. Mm-hmm. And I'm a big believer in Western medicine. I'm not anti-medication, but I do believe we need to start at the lowest possible level first. Yeah. If someone can be treated or effectively treated without medication, there's no reason to give them medication. There's no reason to modify their serotonin or any of the other neurotransmitters in their brain. But one of the most interesting ways of approaching it is when I took a DSM-5 class. My instructor at the time, he had said that if you're hearing voices in the room, you're not going to be able to you're not going to be able to concentrate on your counselor's voice. So what you need to do is you need to find the medicine or the ability to turn those other voices down, not turn them off because they won't turn off, but to turn them down to the point where you can have a conversation and you can actually get a grasp on reality. Now, whether those are voices because you happen to have, a schizotype disorder, or if you happen to have depression, anxiety, and it's an internal voice and you're trying to speak with your counselor, but your interpersonal voice is just like, no, you're pathetic, you're a waste of time, or you have to worry about this throughout the day, you're not going to be fully vested in counseling. You're not going to be fully vested in the time you spend with your family. You're not going to be fully vested in your job because you're going to be so focused on this interpersonal conversation going on with you that at that point, medication may be required, even as just a temporary fix, so that you can get the behavioral therapy you need, whether it be, CBT, psychoanalysis, whatever. If you have a life coach, something to help push you through the process to the point where you can reframe and restructure and then get off the medication and then be fine operating throughout the day.
I would just ask, I suppose, because we've covered a lot in surprisingly short amount of time. Normally, these types of conversations, when it comes to John and I, go on for a full hour. I would just ask you guys to sort of tell me like what some of the symptoms are that people in my audience should be paying attention to, people that might not realize that they might have it. And then I suppose to follow up on that, once people discover that they have these symptoms, or if you already know that you have these symptoms, what should they immediately do upon discovering that?
Well, in my case, I don't do assessments and diagnosis, but if people come in and their emotional dysregulation is obvious or memory is obviously, affected by something that seems like trauma, my approach is to try to get them healthy in general ways. So, for instance, I would always ask about what time you get up in the morning, and are you getting up at all hours? What sort of thing are you eating? Are you eating junk food all the time? Are you drinking liters and liters of Coke? So mine is a much more blunderbuss approach, where I encourage them to get their physical and mental health kind of working in a positive way.
Right.
So it may be that they just need to move more. They get more oxygen flowing in their blood, that kind of thing. So that actually helps with anxiety and trauma. But one of the big things that I've discovered in my work is that often a dysregulated brain learns regulation, which the body can teach it if you start setting routines that are predictable, like getting up in the morning, or like, eating this way, or doing that this way, or always going to the gym at this time. It seems like with my clients, there's a lot of looseness. So they have to go into their prefrontal cortex and decide, oh, I have to do this now. But the dysregulation means that their limbic system and the prefrontal cortex are not doing their separate discrete work. Mm-hmm. And so emotion sabotages their thought processes. So what I'm discovering is that we can sometimes get some orderliness back simply by establishing some set patterns in the day that are productive and even just happy. Mm-hmm. So movements become predictable and reliable. So the first one is getting up in the morning.
That makes sense. When it comes to things that people can do that are within their immediate ability to do, that they can just do on their own, those are some of the simplest and healthiest things that you can do. It's just eating better, getting up at a set time every single morning, doing proper exercise. Because when you're in a depressive state, whether you have PTSD or one of the more extreme diagnoses, what you tend to do is you tend to let your emotions get the best of you and then go into unhealthy habits, eating, sleeping, all that sort of stuff. If you are told to just do those things, and compared to some of the money you might spend on cognitive behavioral therapy or a medication, those things are within your control and are relatively cheap. So I recommend those. But beyond sort of that, Corbin, when those sort of things don't work, what would you recommend to people who are dealing with PTSD? What they should do immediately and then sort of maybe long term?
Yeah, I mean, PTSD can cause numerous symptoms, suicidal ideation can be one of them. So the first and foremost thing I would recommend is if you are having any thoughts of suicide or self-harm or harming somebody else, I would look at that point, looking at, calling 911, get yourself into a safe space. And if you do feel like you're in a place where it's manageable and you can take the time to reach out and talk to someone, I think that's a fantastic option. There's so many different methods for outreach these days. I mean, you can go to a clinic and you can talk to a counselor. If you don't want to go in, you're more comfortable staying at home, there's the telehealth option. There's a lot of different apps you can get now where you can actually just video chat with the counselor and just kind of get it out there. A lot of counselors will use what's called a sliding scale fee. And that's where your sessions are based off of income rather than a fixed, to go see a counselor, it's $100 and something. You can see a counselor for $10 to nothing, depending on how much you make. Insurance in certain instances will cover therapy, of course, as well. But I truly believe that, once again, you guys hit it on the head, daily activities of living, having a structured lifestyle is often the best way to get yourself out of a funk. If that's not remedying the problem and you're still having the symptoms of feeling anxiety or feeling an undiagnosed fear that you can't understand where it's coming from, or memory displacement, you can't remember certain periods of time, that's often a sign that your mind is repressing something traumatic. And sometimes your peers can be a good indicator too. Sometimes it's hard to realize looking inward that I'm different, I'm changing. But if your family or your friends, they're starting to notice like, hey, are you okay? Or they're asking those questions. Sometimes it's worth investigating, even if you're 100% positive that you're fine. Sometimes it's always nice to get a professional opinion as well.
So just before we conclude, I just want to emphasize a couple things that Corbin said, one that was a few minutes ago, one that he just said. I know that the process of trying to get better can seem daunting. It might seem painful to a lot of you. It doesn't have to be, because as Corbin said, especially if you have PTSD, there are ways that you can go about this that are slow, comfortable, yet effective. And it can be tailored to you. You just need to sort of allow yourself and force yourself to investigate a whole bunch of different options. And then when you get the taste of what your life can be, once you're able to confront the things that have traumatized you and then move beyond them, you'll it'll feel like this immense weight is lifted off your shoulders. You'll be able to see the beauty in life again. I haven't had PTSD, but I've been in depressive states, and I know what it's like to go from that to where I am right now, for example, where everything's great. And of course, the sliding scale pay thing, there are people that do counseling and psychology and all that are willing to help you. This is something that I'm saying to people. There are complete strangers that are willing to help you and will do it for relatively cheap just because they get a great deal of meaning about it. One of the things that Corbin and I talk about a lot is like some of the most meaningful stuff that we've ever done is just sitting down, talking to people, helping them through their issues. It's why he's going into what he's doing. And that's why I want to go into it starting in the new year. And there will be people that don't charge a whole lot of money for it. So don't let that be a factor in regards to whether or not you decide to get healthy, because there are people out there that are willing to help you no matter what it takes. So any final thoughts or comments that you guys would like to offer before we close things out?
I just want to say it's been a pleasure to meet you, Corbin. I like listening to the way you talk and conceptualize the issues in a sophisticated, straightforward, clear way.
Yeah,
Thanks
very
so.
much. Thank you.
Thank you. Yeah, no, the feeling's definitely been mutual. It's been a pleasure sitting down and talking to both you gentlemen. And then as a parting thought, one thing I like to tell my clients too is that if you can ever picture yourself as a glass of water, and that water inside that glass is everything you have to give on a daily basis. And picture all these empty glasses in front of you, friends, family, work, school. And every single day you're pouring a little bit of yourself into these different glasses. But eventually you're going to run out of water. And the only way to fill your glass is by taking care of yourself and getting help if you need it. You can't give anymore, no matter how much you try. You try to pour your glass and there's nothing in there left to give. You're not giving all of yourself that you could be giving if you're not taking care of yourself first. And that's something that we forget, is that we have to take care of ourselves first in order to take care of those around us.
Excellent.
Lovely.